The Federal and Thomas Hospital Puliangudi jointly present the Tenkasi Marathon 2025. This event is co-presented by Selvarani Readymades and powered by Repco Home Finance and Sriram Nalamani Yadava Educational Institutions. Run for Health on Sunday, June 29.
In the rapidly evolving healthcare landscape, the integration of new age technologies is transforming how care is delivered. The big question is, are our healthcare professionals equipped for this digital revolution? The occasion was the third edition of the Nadu Health Skills Summit 2025 at the Anna Centenary Auditorium in Kottuppuram in Chennai. The same event where the Federal is the official digital partner. In one of the panel discussions titled New Age Technologies in Healthcare, Training the Digital First Workforce, brought together experts to discuss the same. Kicking off the discussion, Professor Prabdeep Kaur emphasized the need for a multidisciplinary approach to train healthcare stakeholders in cutting-edge technologies.
I think today we are going through the times when AI and digital is unavoidable. So no matter what your basic education background has been, you will need to develop some skills in this area to stay competitive and to be in the job market. So we actually developed an interdisciplinary course on AI for health. It was a 3-day course, and I wasn't sure whether there will be takers. And for 80 seats which we had available, we had 600 applications. People are willing to invest their time and effort to actually take up these kind of programs. But I think the challenge is actually developing these programs. So I think the solution lies in really developing different kinds of program. Like we need to have a big menu. It has to be interdisciplinary at the design, and even the faculty for these courses need to be very interdisciplinary.
Talking about the need to train the public health staff at the ground level, Dr. Ganesh Kumar also emphasized the importance of balancing technology with human expertise.
As we all aware, the technology is changing, the skilling has to be changed and it has to be primed. It's not so static, despite the concepts remains the same. But what we have understood from the field epidemiology training program here is that not just per se at the one program manager or the district epidemiologist needs that kind of an orientation, because the data and factual data originates from the ground level. So the true skilling of what's the importance of getting the right data from the ground level matters a lot. Are we just dealing with the right data or not? All these things requires continuous skilling of them. All these things is what I am trying to root here is that the skilling of the ground level government workforce requires, and it's a protection of the population.
Dr. Lallu Joseph from Christian Medical College addressed the generational divide in digital literacy and the need for continuous upskilling in hospitals.
Healthcare is not one set of people. You have the doctors, you have the nurses, you have the technicians, you've got n number of professionals working. So it's not a uniform solution that we can look at. So that is why I think it's very important that we all work together as different people from different fraternity coming together, understanding the real needs within the hospital ecosystem, and then providing solutions at various levels. So the need is not just skilling, but also upskilling in a big way.
Experts also underscored the role of global initiatives in bridging the digital literacy gap to enhance healthcare outcomes.
We all know there is a knowledge gap, a skill gap, as well as a competency gap when the health professionals having the least digital literacy. So from data literacy to this basic data interpretation skills, most of the health managers lack that confidence and that skill mix. And one reason is that they are seeing digital health as a vertical, but not as an enabler for health system or service delivery. So this lack of understanding that digital health tools are in a way enabler to the service delivery and referral pathways, and even there exists a bigger gap of even understanding the routine health management information system. And so I think one solution could be of assessing. We haven't done any competency, we have something known as clinical competency mapping. So like for the digital also, we can have a clinical digital competency mapping could be done to understand what are the digital competencies required for a health manager, where is the gap, and then we can address that.
The panel's insights clearly stated that to harness the power of new age technologies in healthcare, one must invest in training programs that bridge digital literacy gaps, foster innovation, and balance technology with human expertise. Health is invaluable, and healthcare is no longer a choice, it's a collective responsibility.
The Federal and Thomas Hospital jointly present the Tenkasi Marathon 2025. This event is co-presented by Selvarani Readymades, powered by Repco Home Finance and Sriram Nallamani Yadava Educational Institutions, along with associate sponsors Treasure Island International School, Homeway Properties, PPR Power Tech, and Premium Samsung Cafe. Run for Health on Sunday, June 29. Entry is free. All are welcome.